Hello, everyone, and welcome to this new episode. Today, I'm partnering with a new page called Med Reviews with Sam, and we have Sam here, who's been a pharmacist for about 25 years. He's started this page in order to explore different aspects of medications, but I don't want to stress too much about his page. I want you to do the introduction for yourself. So tell me a little bit about why you started this page. What are your goals from starting this page?
Good question. So my name is Sam. I have been a pharmacist for about 25 years. I have been in pharmacy practice for close to 28 years. I enjoy doing pharmacy work. I enjoy the ability to influence people's lives and help them on their path to a healthy lifestyle and understanding why and how to take their medications. I think this is important because, based on my experience, you find many people that are not aware of how to use their medications or
Mhm.
what to expect of their medications. And I think the biggest driver for me was when my daughter had what she's diagnosed with right now with hemiplegic migraine. I found myself searching for answers, from different neurologists and trying to understand what's happening, and it's quite complicated and emotionally draining when you're trying to find information about something and you don't have the right resources or the right knowledge around it. And I think it becomes important for people on my page because I have a wealth of knowledge and expertise behind me. I have had hospital experience. I have done long-term care. At some point, I was a geriatric pharmacist board certified, which now expired. That's why I said at some point it's not active, but it's definitely something that can be easily reactivated. I've done long-term in a retail setting, so a wealth of information that I would like to share with the audience and hopefully answer their questions.
That's great. That's great. Well, first of all, I just wanted to talk from my personal experience. He's a very, very well put together pharmacist. He's very passionate about his field. I know I one time asked you about if you were to go to work and money wasn't in the picture, would you still do pharmacy? And your answer to that was, I would go do pharmacy even if it were free. So the
Correct.
passion is most definitely there.
100%.
But let's dive into the main meats and potatoes of today's video. Today we're going to talk about antidepressants and why some of them work on certain people, some people benefit from them, and some people don't. And it's a very weird and complicated topic, so I wanted to just interview you and get some information about this. The first question I have for you are, what are the most common types of antidepressants and how do they work?
Okay, that's a good question. So the good news is that there are many options of antidepressants that are available to individuals that need them. The most commonly used ones are what we call the SSRIs, selective serotonin reuptake inhibitors, and those are things that improve the amount of serotonin available in the blood and therefore giving you that quote unquote happy feeling or lift me up feeling. These are the most commonly used ones. But within this class, also there are the subclasses that make one more optimal than another based on the presentation of the patient who is about to use them. So, in terms of classes, there are the SSRIs, the SNRIs, and those in between. And obviously, the idea of this page is for people to understand what those medications are, examples of those medications, and what potential side effects to look for without jumping into the mechanism of action, which becomes less of a concern for the average individual or
Right.
everyday individual.
Mhm.
Go ahead.
Yeah, so tell me why some people benefit from these antidepressants and some people don't? Because I know that I have some friends that take, for example, Lexapro and that works very well. Others take citalopram that works very well. But why is it that some people benefit from different types of medications? Can you tell me a little bit about that?
Absolutely. So this is another good question. So example of medications, like you mentioned, couple, citalopram, escitalopram, Prozac, also known as fluoxetine, Paxil or paroxetine. This is an example. Trintellix. There's so many different options. Bupropion, venlafaxine, so many options out there. But then you need to pay attention as to what is the better one for you, and what is the one that is going to work based on your symptom. Like, for example, why would someone lean more towards Paxil or paroxetine versus leaning more towards Prozac or fluoxetine, right? Both SSRIs. So you will find that medications like Paxil or paroxetine has a sedating effect, right?
Okay.
So it also helps with social anxiety, it helps with sleep. So if those are your symptoms or even obsessive compulsive type situations, then I'd lean more towards using something like paroxetine in those individuals. If weight is an issue, and maybe sleepiness throughout the day, I would maybe lean more towards bupropion. So you'd look at the side effect of a medication to help you decide, or the presentation of the patient to help you decide which medication to go with. Venlafaxine, for example, also known as Effexor, can affect blood pressure. So now if you are a patient with blood pressure condition, would that be the right option for you? Obviously not in that case, obviously, unless it's indicated by a physician based on his or her expertise. Then we go that route. I do want to also say that your physician knows your situation best and understands your history and lab work best, and therefore you should follow his or her advice. My case here is to help you answer some questions about the medications, interactions, side effects, after the physician has made his or her decision on what is prescribed and what is best for you. You, however, as a patient, have a right, and the wise thing to do is to ask questions. For example, if you are someone with heart condition and you already have some type of arrhythmia, and then like your physician prescribes some medication that can potentially affect that arrhythmia negatively. For example, medications like citalopram or escitalopram can cause something we call QTc prolongation, right? So if you are someone with a heart condition with a condition that is a sub example of QTc prolonging, I wouldn't resort to those type of products. So those are some of the things you need to look at. Additionally, as to why certain medications work for some, not others, one, you need to understand that the medication itself has a way of affecting the patient or the individual, and then your body has a way that affects the medication. So there is like a pharmacokinetic and a pharmacodynamic component that affects how you respond to those medications or how the medication will affect you. I also always tell patients that listen to your body, right? So your body knows best. If you experience something that wasn't present before taking the medication, obviously it's something that you need to discuss with your provider. There's also the genetic component, how you're going to respond to that product, how that product is being metabolized in your body. That's also something to consider as well.
Most definitely.
Yes.
You mentioned a few very key important facts there. So one, the physician knows more about the patient.
Correct.
So the physician is basically the person who's like leading the ship, and you're more of a mediator. You redirect people in a certain direction that tell them you should try this medication instead of that medication, and that's something the patient can discuss with their doctor.
That's the key. The
Okay.
key is I provide the information, and that information needs to be presented to your provider, who in turn can dig into the information that we have available to us as professionals and make a determination what's right for you. By no means am I in a position to say stop this or take that. I would make recommendation of what I strongly believe based on the facts and evidence that a certain product is better than the other.
Hmm.
But the ultimate, and underline the word, the ultimate decision here is for the physician that you are under the care of.
Most definitely. And the patient, you also mentioned that a very important thing, I think, in my opinion, is the patient should listen to their body, right? Because our
Absolutely.
body communicates with us and tells us how it feels. If it's benefiting from it, you're going to feel more happy, right? Because that's the whole point of the medication.
Right.
And this leads me into my next question. What factors go into switching a medication? Let's say a patient doesn't see much benefit. How long should they wait before they talk to their doctor about switching the medication?
What a great question. What I see in practice is that many physicians make fast change.
Right.
Like they make an appointment like in 7 days. And you will find when you are on medications that, such as SSRIs, for the treatment of anxiety slash depression, these medications take time to work. And if you dig into in literature, you will find that some of these medications take 4 to 6 weeks to get the full effect. So do not be discouraged if you feel that you are taking a medication for 1 week or 2 weeks and feel like, oh, I'm not doing well on this medication, I need to change it.
Right.
So if you get anything out of this, is that make sure to go at least 4 weeks on the medication, provided you can tolerate it, and then communicate to your provider how you're feeling, and whether you should continue, adjust the dose, reduce the dose, or make any changes. So that's a very good question you asked there.
Thank you. Thank you. And then you kind of already answered this previously, but I'm still going to ask you, maybe there's something you want to add to it. But how or what are the most misunderstood aspects of antidepressants? Like, what are antidepressants taken for? Obviously, depression is one of them, but how do you diagnose depression? How do providers diagnose depression? And how do you know when you should start taking an antidepressant? When is it recommended?
So the part about diagnosing depression would be me overstepping and making the diagnosis for depression. But obviously there are certain guidelines that providers and physicians follow to make this diagnosis. And obviously depression is not just you being unhappy. There are components of depressions or different subtypes of depression. For example, you find the best treatment for anxiety is an SSRI plus what we call a bridge therapy, such as the benzodiazepine, the Xanax, the Valium, and the alprazolam, which is the generic name for the Xanax, lorazepam, clonazepam. These are some examples. But what I also find in practice is that many physicians choose to go only with what we call the quote unquote bridge therapy, such as the benzodiazepine, like the Xanax and the Ativan and the Valium, and they forget about the backbone of the treatment for anxiety. And in this case, is an SSRI. It doesn't mean you're depressed for you being on that SSRI, but it's really the important backbone of treatment for anxiety in this case. Additionally, you will find if you only do what I call the patch therapy, meaning the benzodiazepine, remember these come with side effects like being addicted to the product in the long run, developing tolerance to those products to where you require higher doses to get the same effect, which kind of a sword with two edges where you can inadvertently get hooked on these products, and we see that a lot in practice.
Definitely.
Yeah.
Now, I see that we are nearing the end of our video. I want to really thank you for taking the time and coming onto the channel today. I want everybody that's interested in medicine or interested in knowing more about medications, wants to know more about their medications, to follow my dad's page. Again, it's Med Reviews with Sam. I'm going to drop the name in the description below. And stay tuned for more videos. Thank you so much. Thank you for being on the channel today.
Thank you very much. And I do want to conclude by saying thank you for having me today. It's definitely a pleasure giving back. And once again, I want to remind the audience the idea of the page is me giving back based on my experience with my daughter and the overwhelming emotional feeling, trying to look for answers that you don't always have the resources for. You are welcome to also leave a message as to what you want me to talk about in the future in terms of medications and side effect, or a group of medications that you would like me to discuss in the future as well. This is provided to you as a way for me to give back and practice something that I love doing.
What a beautiful thing. All right, guys, thank you so much, and stay tuned for more videos. See you next time.